Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello, everyone, and welcome back to another week of the Healthy Habits for Active Aging podcast. We are on episode number 38, and today we have a very special episode as we have a guest here, Dr. Jill Oertle, and she's actually one of our very own therapists with iMove PT. And we're very excited because today she's going to be talking about fall preventions for people with Parkinson's disease. So if you've been following our podcast the past couple weeks, you will know that we've been talking about statistics in regards to falling and aging, risk factors, certain diagnoses they may put you more at risk for falling, and then exercise prescription to help reduce your risk of falling. But today we're going to talk specifically about Parkinson's disease and kind of pick Dr. Oertle's brain about how physical therapy can help, what you can do on your own, and specific exercise prescription. So thank you, Dr. Jill Oertle, for joining us today. We appreciate you for being here with us.
Thank you for having me.
Of course. And so like I said, she is a doctor of physical therapy with our company, iMove PT, and she just has this special interest of treating people with Parkinson's disease and has a couple extra certifications with it. So I'll just let Jill go ahead and start off. Tell us a little bit about yourself.
Okay. So I've been a physical therapist for over 20 years now. But I didn't really develop my my love for treating Parkinson's disease until I started working in the assisted living setting, where I had patients that I kind of got to follow over the course of years, and got close with the families and kind of saw the disease progression. So that's when I decided to kind of get the special certification, which we'll talk about that later, LSVT BIG certification for treating patients with Parkinson's. So now I really enjoy getting to utilize that within the company.
Awesome. Thank you. So we have talked in the previous podcast that people with Parkinson's disease are at risk of falls. And can you elaborate a little bit more from what you know as to why that is? What makes somebody more susceptible just by given that diagnosis?
Sure. So Parkinson's, as we all probably know, it affects the brain's ability to sort of control movement, balance, coordination, posture. And some of the hallmark signs that we see in someone with Parkinson's disease is difficulty with transitioning from sitting to standing, difficulty with turning in place, difficulty with their walking. They kind of get that typical, they call it a festinating gait, which means their steps become small and quick. And it almost looks like their feet can't keep up with their body. And then sort of that stooped posture that we see so often. And so all these things kind of together just sets the patient up for losing their balance. So and then other things with Parkinson's disease is that are also factors to consider is the changes in blood pressure and heart rate that come with the disease that can lead to dizziness and fainting, things like that sometimes requires some extra management.
Yeah, and I would say with my experience, you definitely have more experience with Parkinson's than I do, but like you talked about that initiation of movement, I know that it's kind of a problem with the basal ganglia of somebody's brain. And so they have trouble starting movement, but sometimes once they get going, or you just give them a little verbal cue, they'll take off. And so we'll talk in a minute more about that. But I think that like you said, that fascinating gait that wants to go, but it doesn't really know how to initiate that movement would you say, is that when most falls occur?
Yeah, sometimes it's difficulty initiating movement, and sometimes it's difficulty stopping movement, kind of in the same way people get going and they can't stop. Okay. So yeah, it goes both ways.
And then I've also heard of like there's two different types of Parkinson's. So some of my patients may have more of the tremor based, or they have that like pill rolling. Well, they'll want to kind of do this or can't control their movements. But then there's another type of Parkinson's that they have more balance issues and they do report more falls than somebody maybe with just the tremor. Is that true?
Yeah, and sometimes the tremors are more a side effect of medication than it is the
Okay.
actual disease, which is, kind of an interesting fact because people always associate that with the disease, and a lot of times that's the medication. So,
Oh, okay.
yeah.
That's a good point. Okay, so now that we know this and like what makes somebody with Parkinson's more susceptible because of posture, initiating movement, and those short little stutters and speed, is there anything that, with physical therapy, we give them exercises and we will teach them that, but say that there's just somebody on their own wants to be able to do something or an exercise routine, like, do you have any suggestions?
Um, I think, I mean, any type of exercise program where it's just going to keep you active, something that you can stick to. But I personally think that the best route, if you have Parkinson's disease, is to seek, professional help of a physical therapist. Talk to your doctor about it so that the therapist can really evaluate what your impairments are and what your exercise program needs to look like, because they're not all the same. There's not one exercise program for Parkinson's disease. It'll be different depending, everyone's different and their disease progression is different. So, but the biggest thing is once you get that program, being able to transition to some sort of community-based program or something that you can do in your home, something that you can stick to, because that's the biggest thing. You have to be active and stick with it. And there's so many new community classes. There's boxing and dance classes and Tai Chi, yoga, so many more things now than what there were even just 10 years ago that patients can
Yeah.
get involved in. The local YMCA here has like a Parkinson's class that has spinning and like kind of a chair exercise section. And so sometimes I'll take my patients, and when we're wrapping up therapy, we'll go to the Y and I'll try to get them integrated into a class like
That's
that. Or
awesome.
yeah.
Yeah, I do
Um,
know that that's awesome because the couple of my patients that I've had, they'll speak very highly of participating in a boxing, like the Rock Steady boxing class or yoga and Tai Chi. Like you said, that's becoming really, really big. It keeps them active, keeps them social. I think those social skills are really important because as Parkinson's progresses, a lot of times people get that really flat effect. They don't show a lot of emotion. So, all of the above, I think there's more pros than cons in participating in something like that. So, it's a really good point. Um, what about assistive devices? Because I know that I guess it's going to totally depend on the patient, the person itself, but sometimes an assisted device, from what I understand, is like too much for somebody with Parkinson's to concentrate on. Do you have a preference?
yeah, I've experienced patients where I would agree with that. A lot of people don't know. Have you heard of the U-Step before? The
Yeah.
U-Step walker? Yeah.
Hmm.
So
Yeah.
the U-Step walker is a good resource. It's covered by Medicare. It's a good assistive device for people with Parkinson's disease. It has, trying to think what all the features are. It has like tension control on the wheels so that you can actually set it so that it doesn't go too fast.
Okay.
It has the reverse braking system where instead of like on a regular rollator type walker, it has the brakes that you squeeze to stop it. The U-Step, you actually squeeze to let it so that it'll roll. And when you release it, it stops. So
Okay.
it just makes it more stable if they're going to turn and sit on it or, use it to kind of help stand up or, and then they also have this like either auditory or visual cueing modules that can be purchased with it, where it has a laser that gives that kind of visual cue to help with your step length, and then of course the auditory component to help like slow down your cadence a little bit with the walking. So just some really neat features on that U-Step walker, and it is covered by Medicare. So
Okay. I can't say I've
yeah.
ever had a patient with that, but I know we've talked about it before, and I think it's a great suggestion for people out there if they don't know about it already.
Yeah.
especially being covered by Medicare for this population.
Right.
That's a great suggestion. Okay, so let's get to the good part. You are LSVT BIG certified, which is a treatment for Parkinson's. So could you tell us what that is, what it stands for, and just anything
Yeah.
about it you want to share?
Sure. So LSVT BIG, it's a certification for, it's a specialized treatment for patients with Parkinson's disease. It stands for Lee Silverman Voice Treatment, which is interesting because it started off as a speech therapy treatment for Parkinson's disease to help increase the volume that patients speak. So it started off as speech therapy, and then it took sort of some of this same concepts of and created a physical therapy treatment. So it's LSVT BIG. So, I mean, basically what it is, it's, I would say it's the best way to summarize it is it's treatment focused on teaching the patient to move with a more normal amplitude, which is going to be a bigger amplitude. Patients with Parkinson's, they do everything small. And their steps get small, their movements become small, their movements become slow. Everything just kind of goes down. But they don't realize it. And that's what's interesting. I had a patient that I videoed her doing sort of like a little line dance kind of, and she used to be a dancer, and in her mind, she was, what the video looked like when I showed it to her was very different than what she thought. She looked at it and said, well, I'm barely moving. Why am I not taking bigger steps? She had no idea. She felt like she was really moving and, swinging her hips and all these things. And she wasn't. So it's that teaching them how to think about exaggerating their movement to where it actually looks normal. So increasing the amplitude of movement. So we call that calibrations. We try to calibrate the patient and reteach them what normal movement really feels like. So it's going to require a lot more effort for the patient to try to move with a bigger amplitude. So they have to think about that all the time, moving with a larger effort than what they used to have to think about, if that makes sense.
Mm-hmm. Yeah, I used a little bit of it. I'm not certified like you are, but I know that if you can get them to count and kind of like yell as they count their repetitions, or even if they're doing arm motions, you're having them even like spread their fingers and reach out as far as I can. And so I know that there's a couple of routines you can do, even like sitting in a chair, standing, just kind of make everything safe. And I think even a couple of my speech pathologist friends do a little bit of the LSVT as well with voice stress. So it's kind of the whole picture.
Yeah. So there's a series of exercises that you do with the patient during each session where you're really focused on that calibration. So you're teaching them the exercises, and as they're doing them, you're correcting their movements and showing them how to do it even bigger, even better. And then they do these exercises at home on their own. Another portion of the treatment is you take different functional things that they do on a daily basis that they might struggle with and incorporate that into the treatment, again, with calibrating their movement. And then another thing they call hierarchy tasks. It's a more complex task that they might struggle with, like, maybe they have difficulty opening a door and walking through a certain door, which can be hard to do, managing a walker, or difficulty, anything really, doing laundry, or whatever they're struggling with. It's sort of individualized to them, where you're teaching them how to complete that task effectively and safely.
So me being kind of limited, not knowing the full LSVT BIG certification, I know one of the most common things I use out there is just like a metronome. If I'm trying to get somebody to step faster, to try to get out of that shuffling or fascinating gait pattern. I don't know about you, but my experience is having a metronome where it's constantly ticking, and every time they hear that beat, they're stepping. It really improves. And I like to use video like you do, and without the metronome and then with the metronome. And I think it's pretty eye-opening for these think and then they'll use it on their own or listen to music, Staying Alive, or if you have any other fun songs you like to listen to. But yeah, that's been very helpful for me.
Yeah, the music, just like the metronome, the music, same concept, is staying on the beat with music. And it's fun, whenever they can think about walking to music or moving to music. Yeah.
It's so fun. So if you're listening to this, or you have a family member, or you're the patient yourself, and you're hearing these ideas and maybe you've never tried them before, maybe you've never enrolled in a class of Tai Chi, yoga, or been in physical therapy, or had a trainer, or even listen to music, walk to your music, like try it or reach out, because I think you'd really be surprised, and record yourself or your family member. But yeah, so Jill, if you would say your biggest take home from this podcast you want our listeners to get from this podcast, do you have any words of advice or take home message for us?
I think my biggest take home message would just be that people are living fulfilling lives with Parkinson's disease now, and there is just so many more resources and treatments than what there used to be. And that if you kind of work, collaborate with your doctor, your therapist, whatever community program you're involved in for your exercise, it really can be managed, and, falls can be reduced if not prevented. So I would say just get on board and get that team going and get moving.
Yeah, I really like that team effort. It really is a team. It's yourself to be able to reach out and recognize if you're having trouble, or before you even start having trouble, get that doctor involved, and medicine's taken care of, and PT and family. I think it's, like you said, it's a whole team. Everybody has to be on board to help you out. So falls, as we've learned in the previous podcasts, can lead to injury. Once you have one fall, you're at double risk for having another fall. Very high hospitalizations and injury, and even death in older people over 65. So don't let this be you. Be proactive. And if you have Parkinson's disease or know somebody that has it, please share this. We really appreciate you, Dr. Jill Oertle, on being on tonight. It's a Friday night. I know she has other things to do with her kids, but we really appreciate your time and effort to be with us today to share this.
I appreciate you having me.
Of course. So like I said, she works with us at iMove PT. She is in the Southern Illinois region, right, Jill?
Metro East Illinois.
Metro East. Okay. Metro East Illinois. I'm over right across the river in Missouri. But even if you're listening from afar, please reach out to us or another healthcare professional. But if you want to reach out to us, it's info@imovephysicaltherapy.com. Please, if you want to see Jill and I's faces, you can listen to us on the iMove PT channel on YouTube. Otherwise, you can listen to us on Spotify and Google, Apple Podcasts. And please listen, subscribe, and share. We really do appreciate your guys' time every single week with us. I am not sure yet on the topic for next week, so stay tuned. It'll be a surprise. So once again, thanks, Jill. I really appreciate you tuning in with us this week and all your efforts you do with us at iMove. Yeah. All right. Have a good night. We'll see you all next week.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@imovephysicaltherapy.com. To learn more about healthy aging, visit our website at imovephysicaltherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.